This means for all of us enhancing and well in place, and that we also have the social and structural enablers and regulation in place to optimize the impact and the sustainability of the HIV programs. We talk about integrated service packages tailored to and delivered in people-centered approach to reduce inequalities, support community-led response in inclusive HIV and health governance. So we are looking beyond HIV, and we recognize very well that community leadership is not only on HIV, it cannot be dissociated from leadership on other areas in health and even beyond. And also integrate community-led responses to strengthen national systems for health and to solve services at all levels. Now, 30, 60, 80 means is an acronym. Now it has become easy to refer to it. They refer specifically on service delivery, right? For prevention, testing, treatment, services. That's what the 30 and the 80 mean. But the 1 on 60, the 60% of programs support achievement of societal enablers to be delivered by community-led organizations is very particular and specific and important to focus on. Why? Because it intends to influence the laws and policies and all the enabling environment. And this is not an element that can be easily expected to be funded from domestic resources. And for me, this is the element that ensures the community leadership. You can have community organizations contracted to deliver on service delivery, but they would not be necessarily given the expected leadership within that financing arrangement, while we could meet the 30 and the 80, but without the flexibility to demonstrate leadership and adapt and find solutions and influence policies and laws and the enabling environment, that leadership aspect might be taken out. And that's why we are seeing that it is really important to see the combination of all these targets going together, 30 and 60 and 80%, which would then represent achieving on the community leadership. A little check on the data available. We see that there is still, and this is the graph in the lower right side of the screen demonstrates the situation as we have, although we do realize we need to double check on the quality of data and what it is meant in higher level of specificity when we see that those laws are reported as in place. But also we see now a gap, and the 38 countries, we consider all countries in Asia and the Pacific region, including the islands. And all these things. So we definitely have a gap and a way to continue working. So the financing, priority actions for financing. We know what needs to be done, and we look at this comprehensively from the broader issues and challenges towards the specific needs when we talk about sustainability of organizations or sustainability of key population-specific interventions, which is a subcomponent within the overall thinking of sustaining the HIV response in general in an aspect where it will be integrated with health and beyond. Mobilizing the political leadership and global solidarity is needed to secure the resources needed, both domestic and international. We definitely need that, particularly as we have a large gap. Maximizing the impact of available resources towards equitable and effective access and outcomes. And this is, we will see later, this is particularly important when we consider allocative efficiencies and how the funding or the resources are being used in a way that would achieve best and maximum results with relatively lower costs. Develop and implement context-specific sustainability financing strategies, particularly at national level, because not all countries have the same, are at the same stage of the epidemic, nor have the same governance systems, decentralized versus centralized, nor having the same laws and even and policies governing collaboration with communities and civil society, or even the aspects related to what is there to sustain. Different countries have different levels of dependence on external resources versus domestic resources, and there is need to have context-specific sustainability strategies. And lastly, improving the collection of data. Disaggregated information is really important, and that's in the spirit of reducing inequalities and aiming to maximize impact and transparency and accountability and efficiency, and ensure that the resources are invested well and not leaving anyone behind. So community-led response, to meet the objective community-led response, we are looking forward to mobilizing funding for sustainable community-led responses, ensuring financial support and equitable pay for community-led work, and funding for activities led by networks of people living with disability and of key populations, including those and young people. This is the specific mention in the strategy. But when we look at it from the financing aspect, we look at various things: donor funding for community-led responses, as well as domestic resources for community-led responses. And probably we have more challenge. The challenges for donors versus domestic are completely different. From one side, we look at amounts. From the other side, we look more at the policies allowing for that to happen. In many countries, we have communities able to access external funding to deliver services, but they are not allowed to to access domestic funding due to specific policies and laws. We need to promote and increase the volume and predictability of long-term direct funding for community-led responses, including through establishing funding earmarks across countries and public funding community-led responses. Ensuring that financing, governance, and social financing frameworks for universal health coverage drive progress towards HIV targets, measured by public financing of community-led responses. This is really important, and we see a number of countries already in this region that are already in this stage and have this element as their main focus. And then lastly, implement transition strategies and plans and ensure sustainable funding for programs of key populations and community-led programs. So this is how the aspects of financial sustainability for community-led response is reflected in the global AIDS strategy. So let's look at where we are right now. And I have a few data slides which I always like to bring to contextualize with evidence what we are talking about in this region. We do realize that while we have seen an increase of domestic resources over the past years, and relatively a decrease of international funding available for this region overall, we still have a major gap towards achieving what is meant or what is expected to be the level of resources that would allow us to meet all the 95, 95, 95 and the 10, 10, 10 targets of the strategy. A major gap, which brings the issue of finding solutions to mobilize resources in various ways. And there are various ways, but we need to continue working on that and establishing those solutions. Not only government funding, public resources, but there'll be other ways, including financing mechanisms for UHC, insurance, and other aspects where the resources for the HIV response could be accessed. We realize, we have done some analysis based on very limited data. We should recognize that we have in the region on the expenditures, on the availability of resources. Yes, the way it looks, particularly when we have the big countries, India, China, Thailand, Indonesia, Malaysia, and so on, are taking the majority of their domestic resources. It translates in the image that we are seeing that about 83% of the resources invested on HIV response are from domestic resources and 17% are from international. You can see in the right side the trends that we see between the investments from domestic versus international level, and this is just a comparison between the levels of 2010 versus 2021, and evidently the investments from international resources are decreasing, as we know. The main issue that we are seeing is that there is a little bit of mismatch between where the epidemic is and how the investments are being engaged. So this slide presents now the information that we know about the proportion of key populations out of total new HIV infections, right? And we see, I mean, this is not counting the partners and the stake and the clients and all these things. It's only core key populations, MSM, transgender, sex workers, and people who inject drugs, depending on the data made, analyzed by countries. The blue, which have just appeared right now, could we have muted? Thank you. Represents the proportion of prevention spending out of total HIV expenditure, and we see how minimal that is, much lower in terms of comparison of levels. And even when we consider the proportion of key populations HIV prevention out of HIV expenditure, it's even much lower. Investment is not going for prevention. Mostly it's going for saving lives and treatment, which is rightly so. But if we do not invest sufficiently on prevention, meaning we cannot meet the 30 and the 80, right? Let alone the 60, which is about policies, and investing on enabling environments. But at least this tells us that when we expect that services for key populations are mostly to be delivered by key populations, and you see those level 4%, 7%, and 16% from the investment going for key populations program, prevention programs, it just tells us that we are a little bit too low, far from achieving those targets. And we have situations reflected based on limited information, again, quite old, as you can see, of the sources of funding in a number of countries by prevention versus the different components of the cascade. The next slide, this one clearly shows that when we have domestic resources taken up, it always starts from the treatment side, not from the prevention side, which tends to continue being extremely dependent on external funding. So when we have the 30, 60, 80, and we want to sustain, yes, we look forward to sustaining the investments, and we know that there is a minimal level of investment, well, insufficient, I would say. A lot more is needed to balance out the needs. But also sustaining the transition of what is now funded mostly from external resources to ensure that it is covered up in various ways, including domestic resources. This slide is old, I know, but it tells us a bit of information about the strong dependence on international funding, particularly for prevention, as you can see, and this is by key populations. A major challenge for us if we talk about sustainability. And within that, we talk also about the elements and the challenges in ensuring that that funding available, whether it's domestic or international, is accessible and delivered by community-led organizations for community-led service, for community service delivery. And this brings us to a number of issues. I hope this presentation, although I went a bit over time, but I find it really important to frame the discussion and separate between discussing the need for mobilizing resources for the HIV response in general and sustaining the response, but also within that, the specific need and requirements of sustaining community leadership, community-led response, which has various elements. As mentioned earlier, some of them are about financing, but many are about policies and laws, and also about capacity. And I'm sure the discussions would help deliberate on all the aspects of that sustainability means, of what that sustainability means. So thank you for your time, and I'm here with you if in case there is any further any specific questions to clarify, but also I look forward to the discussions in the following sessions of the webinar. Thank you, over to you. I'll stop sharing now. Jennifer, I think you are muted.
I was not allowed to unmute myself, even as a host. So on that note, a kind reminder to all participants to kindly mute yourself when the session is going on, just so then it minimizes the interruptions to the speaker. And also, I know that, Tafi, when we're in the same meeting, I could actually take a pen and poke you to stop you from continuing on because you're really eating my time. But I can't do that online. But thank you so much for such a comprehensive overview of the key issues, challenges, and opportunities, including the target of 30-60-80 and financing priority actions for financial sustainability of community-led responses. But I think most importantly, one key message, and I think what Tafi is trying to highlight is that there is, and we continue to face this issue of inadequate investment in HIV prevention programs in Asia Pacific, especially investment to community-led responses in our region, and the urgent need for all of us to be working together in turning this situation around. So I think this is a great transition to our next moderated panel discussion on the critical role of community-led HIV responses and financial sustainability challenges. But before I turn the floor over to Francis, and I do want to note that my sincere apologies that I do know there are a number of people who have questions that they might have from Tafi's presentation. If possible, can you please, just because we're running a little bit over time, and I do want to respect of our participants' time as well as the speaker. So if you could please have your question in the chat, that I will direct Tafi to please respond to those in the chat for the group while I turn the floor over to Francis. But a couple housekeeping issues. Please, for those of you who join us late, know that information is available in a number of languages, including Vietnamese, Thai, Bahasa, Indonesian, Khmer, and Burmese. And second, there are a number of, I think, dual identities, people with same login name. I have at least a Wayne Ha on my participants list, and I think that's because a number of people have shared the same link for other people to join. So if possible, please rename yourself so we can properly identify you. I think there's still one more person that has a name of Veronique Colette, who is not my colleague Veronique. So I would like to know who you are for sure. And lastly, I think somebody asked if the materials and the presentations will be made available after the session, and the short answer to that, it's absolutely yes. We'll be making it available to those of you who have registered. So please be sure to register yourself properly. So this next session will be a moderated panel discussion, and we have invited Francis Joseph, the regional coordinator of Network of Asian People Who Use Drugs, to help us facilitate this session. And Francis is a drug user activist who has been working on the health and human rights of people who use drugs in Asia region for almost 2 decades. And he has worked exclusively in the field of HIV prevention, care, support, and mitigation for people who use drugs and inject drugs. So Francis, without further ado, let me turn the floor over to you to help introduce the session and our wonderful panel of speakers. Over to you, Francis.
Thank you, Jennifer. Good morning and good afternoon to everyone present here. Thank you so much for joining, and thank you for giving me this opportunity to facilitate this session. Before starting, I would just, try to kind of, flag some of these issues that has been talked about in the previous session of, about community leadership, the innovative approaches, and the capacity of organization, the 30-60-80 model as a crucial response to community-led responses. The resource gap is, where the financial sustainability challenge is going to impede the good work happening in the region. Hence, I would like to invite the various experts from the field who come with their massive, years of experience working in, in the field of HIV. And I would request, I would like to introduce Dr. Oak Vichaya to please put his camera on, and can the host please pin Dr. Oak Vichaya on the screen, please? Dr. Oak Vichaya is the director of the National Center for HIV/AIDS, Dermatology and STD, in short named as NCHADS of the Ministry of Health, Cambodia. Dr. Chok Vichaya has worked in the field of HIV/AIDS for more than 18 years. The core function of the National Center is to coordinate, collaborate, and lead for HIV responses, follow the strategy plan for HIV/AIDS and STI prevention, care and treatment in the health sector 2021 to 2025. As the director of the National Center, Dr. Vichaya leads, coordinates, and works in partnership with stakeholders and development partners to develop, implement, and monitor the HIV program in the health sector in Cambodia. I would like to welcome Dr. Vichaya. Thank you so much for joining us. Next, I would call upon Mr. Daniel Marguari, who is the Chief Executive of Spiritia, a non-governmental organization in Indonesia, which works to improve the quality of life of people living with HIV through building peer support system. For almost 27 years, Daniel has been working together with and for people living with HIV in Indonesia. Over the last 7 years, Spiritia has managed programs focusing on prevention and PLHIV quality of life as community principal recipient of the Global Fund with a grant value of 2016 to 2023 of more than $80 million. Welcome, Daniel. Thanks for joining us. Next, I would call upon my close colleague and a little sister, Ika Novianti, who is a young woman living with HIV from Indonesia. Ika joined Youth Lead in 2018 as the advocacy officer, and currently she is the regional coordinator of Youth Lead. In her role, Ika represents Youth Lead at various workshops, consultations, and forums to ensure the needs of young key populations are met. Currently, she is in charge of managing the global consortium for the Robert Carr Network Fund grant. Ika represents the young key population in Asia and the Pacific as a young council member of the Global Fund and the developing country NGO delegation at the Global Fund. Welcome, Ika. Last but not the least, I would like to invite upon Anton Ofieldker, who is the founding director of Equal International and has over 25 years of experience in the field of health and international development, training and working initially as a nurse in South Africa. Equal International's focus is on addressing the needs of marginalized communities through strategic guidance, technical support through leadership, facilitating co-creation and evidence-based research. Anton was previously the head of policy for the International HIV/AIDS Alliance. He has played a central role in supporting the interagency task team that helped to define the community system strengthening framework adopted by the Global Fund and other institutions. Thank you so much for joining us, Anton. Can we remove the slide, please, so that we have all the presenters here, please. Yeah. Thank you so much for joining for the panel discussion. I would start off with my question to Dr. Ok Vichia from Cambodia and Chad. Sir, can you tell us about the key successes of the HIV response in Cambodia and how community-led responses have contributed to these successes? What is the specific role of community-led responses in prevention for key populations? And do you foresee an expansion of the role of communities or community-led responses to reach the 2025 targets and the 2030 goal in Cambodia? Thank you.
Yeah, thank you, Francis, and thank you, everybody. Good morning, good afternoon, and thank you for the opportunity. First, I start with the first question, for example, the success of HIV response in Cambodia. Cambodia's HIV response has been remarkable, and Cambodia has turned the tide from the fastest growing HIV epidemic in the region to one of the countries globally to achieve HIV epidemic control. In 2021, it is estimated that we have 24,000 people living with HIV in Cambodia, and 84% of them are on life-saving treatment. Cambodia has attained one of the highest treatment coverage among Asia-Pacific nations. Additionally, 82% of people living with HIV had adhered to adherent and achieved viral load suppression. Cambodia has achieved 90-90 target in 2017. This tremendous achievement in all the success are rooted in innovation, respect for human rights, and gender equality, community engagement with community-based solution, strong political commitment, and leadership of the royal government of Cambodia. Special thanks to the National Aid Authority, Ministry of Health, Ministry of Economic and Finance and Planning, and all government institution development partner for their hard work, strong commitment, and support for HIV response in Cambodia. People living with it and KP community play very important role and contribute to the success of HIV response in the country. We understand very well that that's why Cambodia's government work very closely hand in hand with PLJ and KP community to tackle the most pressing issue for HIV response, like HIV prevention for KP, increase accountability in local community level linkage most vulnerable to treatment services. HIV prevention and community-based HIV testing for KP, that community has been proven to instrumental reaching hard-to-reach key population to ensure that they are equipped with HIV prevention knowledge, access to HIV prevention commodity and HIV testing, creating demand generation and link to services. For example, we also led PrEP implementation and HIV cell testing. Mostly now we also view the PrEP delivery services provided by the community. We say that PrEP delivery community, PrEP delivery in the country. Specifically, a role for community-led response and prevention for KP. Cambodia include HIV prevention for outbreak for KP. For example, we also do the virtual physical outbreak distribution, condom, lubricant, needle, and syringes to provide easy access to HIV testing, community-based HIV cell testing, and also linked to care and treatment for newly diagnosed access to treatment. And this play very important role. And then we also help KP also help to work with NCHAD with ART clinic in all the country to facilitate mobilize to link with the peer and support the peer to access to care and treatment or provide treatment adherence. To support Cambodia toward reaching 25 target and ending AIDS goal, community-led is a very important role to run the last and most difficult mile for ending AIDS. Last mile effort will include reaching hard to reach and currently left behind KP, including young key population, and medical line approach alone will not be successful ending AIDS. Community response also need to keep up with science and innovation such as PrEP, HIV self-testing, making a digitalized intervention to reach younger KP who use technology, social media platform to find their partner and implementing any key innovation which are promising. It's over. Thank you.
Thank you so much, Dr. Vichia. That's like excellent that we see that community level linkages and the PrEP and self-testing is all led by the communities, and inclusion of communities in working with NCHADS is also remarkable. Thank you so much. I'll get back to you with more questions for you. I would move now to Mr. Daniel Marguri. Daniel, Spiritia has a long history of working on the HIV response in Indonesia. Can you tell us what has been the unique contributions of community-led responses in Indonesia with regards to reaching the most vulnerable? Unmute yourself, please.
Yeah, thank you so much. It had been a pleasure for me to engage this important thing. Let me start to inform you that Spiritia has been forming since 27 years ago, and myself also engaged since 27 years ago. Spiritia is the first village HIV and family peer support groups in Indonesia. We have been facilitating the formation of the village HIV peer support system because we came from the peer support groups and we get the benefit of them, and then we creating the system that building the peer support system in Indonesia, in the district level, in the provincial level, and Spiritia become the national village HIV catalyst group, and we call this system and mechanism as a unique network with independent relation, and equal relation, I mean. So it's with many network, I think, in the world. We built this system, we built this network, but the relation is independent and equal. So we have been supporting hundreds, actually, it's more than 200, I think, village HIV groups in all level, in profile, and I think it's more than 50% of the total district. We have more than 500 districts in Indonesia. This system has been reaching and supporting more than 50% of the total district in Indonesia. We have been supporting them with the programs, funding, technical assistance, building the network and referral system together with them, doing advocacy work to strengthen and development of this community group to make them has ability to lead the response, and also has been supporting individuals village HIV in their districts. With this unique system, we have been supporting more than 200,000 village HIVs in Indonesia. Right now, total people who know the status in Indonesia are around 400,000, and we have been supporting more than 100,000 of them. Since 2016, Spiritia, like you informing in the beginning, we become one of the community PR. So I put this is the opportunity. We not only the PR for village HIV quality of life, we also in the prevention part to reach and support the key populations for MSM, TG, and PWIT. So this part that we have been reaching, I think, almost 500,000 MSM in Indonesia, and with thousands transdux and thousands PWITs also. This situation that I put, this is the opportunity for us to have been improving for better engagement for almost 100 community organizations, because with this responsibility as a PR. We have the almost 100 community organization as a SRs, SSRs, implementing units. So it's make them able to lead the response. It's important to lead the response, especially in the district level, because with this opportunity, it's helping them to improve their engagement in the level of their engagement in the provincial or the district to answer or to let the respond with kind of their work in Indonesia. I think I stop here. Thank you.
Thank you so much, Daniel. That was really impressive. 200,000 PLHIV reached through 200 PLHIV groups, 27 years of work, thousands of other key populations from the Soji-esque, and that is really massive that Spiritia has been working, thanks to your great work. And so like building networks, network advocacy groups is really remarkable. Thank you so much. I'll get back to you with more questions. Thank you so much, Daniel. My next question is to Ika from the Youth League. Ika, there are important gaps in service coverage for key populations in the Asia-Pacific region. What is the role of community-led responses to bridge the gaps in services for young key populations? The arguments you use to convince stakeholders of the importance of investing in community-led responses for young key populations.
Thank you, Francis. Good morning, good afternoon, everyone. I'm glad that I'm here with you in this important discussion. That's a lot of questions, actually, like 3 questions. I'll go one by one. Yeah, there are indeed important gaps in the services for young key population in ASEAN and the Pacific. Young people from key population are less likely than their other older counterparts to use HIV prevention services. It's mentioned in the UNAIDS data report that less than half of young people from key population accessed comprehensive HIV prevention services between 2015 and 2020. What is the role of community-led response? As a young population, I would say we understand the needs of and concern of our peers, and we know how and where to reach them. Right, are more likely to earn their trust, and we are well placed to devise a suitable solution. For example, of youth-led services, service delivery, such as the Lighthouse Social Enterprise in Vietnam and Love Yourself in Philippines, that are evidence of the good practices or the success of young people can lead the service. And you see the proof example.
Thank you so much, Ika. That is actually, leading by example. Yeah, yes, the good work of Lighthouse and Love Yourself, and the good practices where, you've done so much of work in the region. Really commendable. Thank you so much, Ika. I'll come back to you. I would like to call upon Anton Ofieldker from the Equal International. Sir, we have heard the perspectives of government and the civil society organization, the regional network representative, regarding the contributions of community-led responses in the countries and in the region. Globally, what evidence exists on the effectiveness and impact of community-led responses? What is the evidence from the Asia-Pacific region? Can you share your experience, please?
Thank you, Francis, and thank you to UNAIDS and partners for inviting Equal to be on the the community delegation work of the Global Fund, and Southern NGO delegation work of the Global Fund. But I also want to, before I answer that, Francis, I want to acknowledge that seeing in the participants in the room just how many leaders there are across the region who are in this meeting, who have been real drivers of evidence-based KP services in the region. I can see many organizations, both across different sectors, government and NGO. And I think one of the reasons why I've been invited to be on the panel, Eco's been invited to be on the panel, is to talk perhaps around, from a broader, maybe international perspective, the challenges of sustained financing resources for community-based responses, particularly community-led and key population-led responses. So I'm just going to reflect on, again, having been involved in supporting community-based led organizations work, both from a technical support perspective, but also resource mobilization over the years. In one sense, it's a shame that we're still having to make the case for the importance of community-based responses, but at the same time, I think we've got to acknowledge the huge amount of progress that's been made, particularly in the Asia region, where we do a lot of work in Africa, for example, and we often showcase some of the pioneering work when it comes to evidence-based, rights-based key population program that happened in the Asia region. So we know that the HIV response cannot exist without community-led, facility-based health services. They're both critical, and they complement each other. Communities can do what government implementers often can't do, and vice versa. Community responses are more cost-effective, but they are so much more. They're also more impactful, more effective, more sustainable, more appropriate. One of our colleagues based in Uganda, who is the sustainable finance lead for the Uganda AIDS Commission, recently did a piece of research that compared 3 funding models. One where funding went from going from the government to itself, particularly for key population and community-led programs. One where governments contracted international professional organizations, and the third model where governments contracted community-based organizations. The third option had better outcomes in all dimensions, from more sustainable, better results, less costly, more accepted and trusted by the community, and there was less corruption and mismanagement. Reasons why community-based organizations, civil societies are essential to the HIV response. Well, CBOs have been able to extend and expand the reach of government-led health systems, added value to HIV prevention efforts and support of people living with HIV in evidence, in adherence and retention. For example, we undertook a piece of research for Frontline AIDS that showed that communities were the first to respond during the COVID pandemic, often long before governments or donors responded, or responses could be mobilized. Key and vulnerable population communities adapted and innovated very quickly, both to protect their members from COVID, to ensure that HIV prevention and treatment services continued, and importantly, many of these community-led innovations have been maintained in the aftermath of COVID. And the kind of innovations that were, Tawfiq mentioned that the importance of innovation. Some of the innovations that we found when we did this research was taking peer-led healthcare models like take-home methadone for people who use drugs or mental health services for marginalized communities into online spaces, moving healthcare provision away from clinics and into the hands of the most marginalized people in communities, and accelerating multi-month dispensing of ARVs. Communities are instrumental in shaping public health policy and government of countries and local programs, as well as in leading advocacy reform and rights-based approaches. For example, in South Africa, just recently, the government has just released for public comment a bill to fully decriminalise sex work. This decision was the result of years of advocacy spearheaded by the sex worker sector, with support from civil society organisations as well as UNAIDS and other donors. In India, sex worker community groups successfully advocated during COVID for sex workers to be included in the social protection efforts for vulnerable populations. And they've mobilized to combat violence towards sex workers and transgender people by informing community members of their rights, supporting them to report violence, and forming rapid response teams to respond to violence. I just want to acknowledge my colleague Maria Stacey, who's based in our Africa office, is in the meeting, and we can share some of the links to these reports that I'm quoting in the chat. To ensure that no one is left behind, that's what our focus is. They are able to reach the most marginalized and excluded populations, key and vulnerable populations, and those with intersectional vulnerabilities. So through advocacy, community-led monitoring, they're also able to highlight the realities of what communities experience when interfacing with health services, and to shine a line on the shortcomings when it comes to things like stockouts, abuses that experienced in health facilities, and politicians don't hear about. I'm going to leave it there, Francis, so you can move on with the other question, but that's just a quick snapshot from our side.
Thank you so very much, Anthony. Thank you. Yes, I also acknowledge that the most vibrant communities, in the HIV movement, we are the, we are the setters. And yes, thank you so much for sharing the progress, the massive progress that has been made. And of course, sharing the 3 funding model movement, the government international and the CBOs. Also about the peer-led healthcare model. Yeah, I also remember that the community proactive, involved in the COVID response, and you study on that, and that's where the community simply engaged in the community-led COVID engagement. Thank you so much. I was requesting you to share which will be helpful. I see that Maya has already been. Thank you so much. My next question, can we come back? Oak Vichya, please. Dr. Oak, recognizing the important roles of community-led responses and their contribution to HIV prevention, care, and treatment towards achieving the 95-95-95 targets, what options do you propose for financing the community-led responses? Do you think that social contracting can be an option using public funding? What would be the benefits that you anticipate from implementing social contracting in Cambodia? And can you elaborate key steps to operationalize it and any challenges that you currently foresee? A long question, but I can repeat if need be. Thank you so much.
Thank you for raising quite long and very strategic and difficult question. So I would like to restate again the role of the community-led response toward achieving 1995 target. Sustainable community-led response is key to maintain the gain and move on the right path to ending AIDS through different and innovative financing mechanism for community. Waiting for the possible financing mechanism to take, and there are other opportunities to support community with the expectation of increasing government funding year by year, contribute to for ARV and commodity for the next grant cycle. And I told to thank for the Global Fund that called allow us to have the opportunity for the new grant for 2024-26 for 24-26. So at that period, our government will contribute more for ARV and community commodity. So there will be more funding space for community-led HIV prevention, testing, care, and support for program, and also opportunity to other financing mechanisms, including social contracting. In addition, this morning our government, royal government, also to address the financial barrier in accessing to healthcare services. Cambodia had launched the ID4 digitalized registration system for all PHA in Cambodia. It's kind of a health insurance scheme that aims to cover all the PHA in the country to access to full services for healthcare when they need it. Another initiative which is being explored is a social enterprise with current USAID is to Chuksaw Clinic, one of the NGO CBO clinic that provide all the service to KP in Phnom Penh to provide HIV prevention, testing, treatment, care and support for KP and people living with HIV. The social contracting is an alternative option we explore in Cambodia, and dialogue has been made since the past few years on this topic. There are examples of this working in health education sector and education sector. However, the progress is slow in the HIV response. Social contracting will provide long-term, we know that will provide long-term benefit and sustainability of all AIDS response by ensuring sustainable financing for community-led responses with government budget. In July 2002, under the leadership of National AIDS Authority with support from UNAIDS, a national consultative workshop was organized with all government development partners, SOC, and community of PHA and KP. As a result, a mini roadmap was developed with clearly defined the key next step. So we need to develop a gap analysis, in particular where the community-led response are most in need to fulfill HIV care and treatment services, the health system, healthcare system. For example, like we also been explore ARV ARV delivery by the community, created the network for PrEP delivery by the community. This is just some kind of example. And also the community feedback mechanism also led by the community. Clearly defined services to be delivered by CSO, with Ministry of Health or Healthcare System, such as prevention, care and treatment support program, identify and develop legal and policy framework and paper-based SOP to enabling social contracting, including defining social contracting model and mechanism, assess CSO capacity gap, and build their capacity for social contracting, pilot test and social contracting model. We also have some challenges for this implementation. For example, we perceive that most stakeholders in the country, we see that this is lots of urgency because we thank for the donor, particular the Global Fund. We have some opportunity, the new grant available for the community response. Relevant government ministry would not see the social contracting as a matter of urgency is now. Narrow fiscal space, COVID-19 pandemic, war in Ukraine, and other have negative impact on Cambodia economy. So social contracting would not be priority among other competing national priorities. So I mean that this is we need also to consider our national available budget that can be afforded, but slowly increase. Like I already said at the beginning, the contribution from the national budget is increased more year by year. For the next year, the government will increase for ARV up to $15 million just for ART. So limit capacity for CSO, CBO, many CBO, CSO have not prepared themselves for social contracting, in particular ensuring sufficient capacity in compliance with would be required for social contracting requirement. So in this sense, so we need to build more, but we, as our national program for HIV response, we also priority to ensure we have the finance to support the community-led response in the country. It's over from my side. Thank you.
Thank you so much, Dr. Vishya. Cambodia seems to be, really progressing towards sustainable financing with, increase in the national budget and, the inclusion, the active role that national government is playing. Yes, ARVs and commodities are essential, for continuous uninterrupted supplies, and, that funding is key and essential. Digitalization is very important, in responding to the HIV pandemic, and of course the feedback mechanisms from the communities are some takeaways that I've got from your responses. Thank you so much, Dr. Vishya. My next question to Daniel is, Daniel, what are the key challenges faced by an organization such as Piritia and other civil society organization and community-led organizations in Indonesia to secure sustainable sources of funding for various aspects of your work, such as services, advocacy, community-led monitoring, and core funding? What, according to you, are the most important elements to consider to gradually build financial sustainability of community-led responses?
Okay, I'm still muted. Yes, thank you so much, Francis. Let me respond on that. Talking of the community-led response, actually where we are right now, in my perspective, community-led responses which not new approach. Community-led already formed since community itself engaged in HIV response. It's a long time ago, 30 years ago or more than that, when we as a community start and engage in the HIV response. That's a community-led. So a community-led automatically has been integrating in all communities engagement. So we cannot divide it. Community-led should under the network or CSO who focus only in advocacy work. In all community organizations, whatever the focus of intervention, community-led response should integrate and become their focus. I believe right now, more difficult challenges we have been facing in Indonesia. Also, I believe in regional, in global, for community organization or network who work focus in advocacy related, who only for advocacy work, compared to service delivery part in terms of funding support, it's more challenging who work only for advocacy work. Like in Indonesia right now, like I told you earlier, for almost 100 community organizations who work in service delivery, right now got the funding from Spiritia. We have been integrating all advocacy works, communities strengthening system, human rights violation related, CRG works, in our all works. It's to lead the HIV response in Indonesia. Although there is no specific budget items what we managing from the global fund relate on that. For the focus, like I talked before. So we have to be realistic also. Not all the lead of community, it's also everything need the budget or specific budget or big budget or of that. But it's very important. We need to build and improve the capacity and skills to lead the HIV response. So to improve the capacity and skills of the community, that's a priority. Then when we are talking about sustainability, it will become difficult. You know how to solve this. There is never ending to discuss about sustainability, because what the solution for this? We are the community organization, is not a private. We are not profit organization. So for Spiritia, a long time ago, maybe 15 or 20 years ago, we have been discussing what is sustainability actually. Sustain to whom? So for the organization like Spiritia to have a saving, asset, how much and how big? So we have been deciding since a long time ago. There are two concepts of sustainability in Spiritia. One, our focus for sustainability to the Spiritia as organization, sustain is Spiritia move forward in a better position, in the better capacity, in the better responsibility, with a bigger role and function, with a better engagement in a bigger level to respond, to lead the HIV response in Indonesia. That's about. We are moving forward. We are come to the higher level of appropriate position, appropriate place to make a decision and engage in with all the stakeholders in terms of decision making and other things. The second thing, because Spiritia building the PLHIV peer support system, so that's about how, because the PLHIV peer support system as a part of the community system, they are the community system, how to make the system in place in the HIV response. Because for Spiritia as an organization, we can close our door anytime. When there is no need for Spiritia to exist anymore, we don't need to exist, we have to close our door. But as a PLHIV peer support group, their voluntarism mechanism, they need to continue. They need to answer the community need in the future, because this system is voluntarism and they have to exist, they have to sustain. So yes, we have to be realistic that the community, especially the organization and network, need the funding to engage and implement their programs. It's true, no doubt. We cannot doubt on that. But in reality, there will no funding or no funding enough or funding access which is able to support all community organization network in country, in the regional, in the global for our engagement. So in the end, it will be selected and only who got the funding with some reason, who can engage in the better position. So with that situation, the future priority in community sustainability is make the community system in place with respect and appropriate position in the country, in the provincial level, in the district level. Thank you.
Wow, Daniel, that was power-packed. Really. Thank you so much. Thanks for highlighting that, this community-led response is not just one aspect, but it should be integrated in all responses. And, thanks for clarifying the service delivery and advocacy work, from your perspective. Thank you so much. Yes, capacity building for advocacy is important, skill building is important, but at the same time, engagement and most importantly, funding is also important. Thank you so much, Daniel. Ika, my next question to Ika. Youth-led organizations in Asia and the Pacific often identify financial sustainability as a challenge they face. Could you describe the gaps that many youth-led organizations in the region which have impacted their ability to be financially sustainable? And as a regional network, what role does Youth Lead play in building the capacity of youth-led organizations to fill this gap?
Oh, okay. Thank you, Francis. With a long question again.
Multiple questions.
I think there are so many gaps and challenges that are faced by Yankee population in the region. First, let's talk about the services. We have we already know that we have very limited youth-friendly services in ASEAN Pacific available, even though there is a service led by Yankee population, but they are very few in number, small in scale, and typically short of funding. At the Youth Forum that we held in October this year, financial sustainability was identified as one of the issues that youth-led organization experience. there are currently few formal organization or network run by young key population in the region registered. So as well, the hampered by limited capacity, experience, and resources, many of youth-led organizations, they rely on the link with the regional networks such as us, Youth Voices Count, and YPR Asia and the Pacific, which are working to boost the involvement of young key population in the region. In terms of what role does youth lead play in building capacity of youth-led organization, YouthLED has been boosting the engagement of young key population in the Global Fund countries consultation, where they can help shape the development of Global Fund grant proposal. We also develop a series of training manuals. For example, Making Money work for young key population in HIV response. It's mostly in the Global Fund work as well, and we provide training for the community-led organization in several countries, along with small grant and the other technical support. I think this is enabling young people from key population to push for their priorities in the country level. And also, we supporting the advocacy for more external resources of youth-led response, including during the Global Fund 7 replenishment, and hopefully in the upcoming COPROC for the PEPFAR next year. That's it. Thank you.
Thank you so much, Ika. Thanks for flagging that. Yeah, we understand that there are limited capacities and resources, but the great work that youth lead is doing with the young key population is engagement of young key population in grant proposals and training and capacity building, and providing technical support. Thank you so much. And that leads to actually strengthening the community-led responses, especially when it comes to young key populations. Thank you so much, Ika. My last question to Anton. Anton, what is the current funding levels and financing models for civil society organizations? There's a disruption somewhere. Can the host please see and mute the person, please? Can you mute yourself, please? Yes, Anton. What is the current funding levels and financing models for civil society organizations and community-led organizations globally? What are the key challenges to sustainability and specifically in the Asia-Pacific region? What is the situation with regards to funding for service delivery and funding for advocacy, community-led monitoring, or core funding? Multiple questions together.
So, Francis, very big and challenging questions. And to respond to that, what I want to encourage us to do is to kind of take a bird's eye view globally. And that's to reflect on the fact that we are currently facing what they call colliding crises. We've got the colliding crises of the cost of fuel, the cost of living, the cost of food, the many implications of Russia's aggression on Ukraine. And what that's leading to is challenges, particularly amongst traditional donors, where they're seeing their commitments to ODA decrease. And why is this important? It's important because as Tawfik showed, that the community-based response so hugely has relied on external donors, still 72% and the like. And so we're in an environment where donor funding isn't reliable, and the UK cut their ODA commitment. Many governments are cutting their ODA commitments, particularly because they're facing increased cost of living and poverty at home. In the UK, for example, 1 in 3 children, you'd be surprised to hear, live in poverty. And so there's increased political kind of pressure for traditional donors to fix the problems at home and prioritize that over ODA. So the long-term transition from relying, well, basically it's essential to transition for sustainable financing, to stop relying on donors, particularly for community-based and key population programs, and transition to a position where sustainable funding for the response is national, incorporated ideally through using social contracting, which means that governments fund interventions. So a couple of points. Even before the COVID pandemic, we saw a leveling out of funding into kind of global funding for the AIDS response. So, for example, from UNAIDS's own report this year, the Danger Report, we saw that there was almost like flatline funding of 21 billion, and that represented a shortfall of what was required for the global AIDS response, which was estimated 29 billion. Resource allocations for HIV by region vary, there's particularly large funding gaps in Eastern Europe, in Central Asia, in the Middle East, North Africa, Asia and the Pacific. So generally the largest funding gap for HIV, around 3.5 billion, is also in low and middle income countries. Overall, low and middle income countries, as we saw from Tawfik's slide, fund about 72% of their funding goes on treatment programs, and only around 42% on prevention. And as we know, this was mostly funded by external donors. We undertook some research for ERASA in 2022, where we found that more organizations have seen an overall decrease in their funding over the last 3 to 5 years. 46% recorded that they'd had decreased funding, where only a third had seen an increase of 33%, and that was mostly around service delivery, while 20% of organizations remained stable. Across the board, in that research, respondents spoke of the waning of core funding and the shift to funding programs focused on biomedical service delivery. Civil society organizations identified how they are finding it increasingly difficult to obtain funding to sustain organizational systems, their core costs. Thus, while donors expect organizations to adhere to increasingly stringent organizational governance criteria in order to access funds and increasingly onerous reporting requirements, the extent to which they are prepared to support organizations to meet the requirements is decreased. So organizations reported that they, despite their own strategic planning process, organizations report that despite their own strategic planning process to ensure that their programs are relevant to the needs of communities they serve, and they had to constantly adapt to the changing donor priorities. So what are some of the challenges for financing? Well, core is the lack of core funding available for society organizations, often overlooked. If you're a community-based organization, you're often a sub-recipient or sub-recipient, and often it's really difficult to get your core costs covered. Lack of funding models for civil society interventions that can easily be incorporated into budgets. I've seen from previous work, particularly with some of the work with partners in India, Alliance India, in CANAR, in Cambodia, with SCDI in Vietnam, and also in Thailand, the key successes that have been achieved by the national AIDS programs of governments focusing on evidence-based programming. That means, working with communities and key populations. And when we see the impact that has the greatest impact, it's the most cost-effective. But at the same time, the challenge of incorporating community-based, community-led programs into national programs that are covered by national budgets remain a real challenge. And I think that's at the heart of our discussion. I think we've seen a lack of funding models for civil society intervention. So when a national program gets budgeted, it's really easy to budget the biomedical interventions. We don't so easily have the community-based standing operating procedures and budgets that can very easily be incorporated into national budgets. That's a challenge. The political barriers include political restrictions on organizations, freedom of association and expression, criminalization of key populations affecting their ability to register, organize, open bank accounts, raise funds, donor-related barriers, such as application requirements, and a bias towards often international NGOs or big NGOs, where we really need donors to rethink their criteria for funding community responses. And part of this is often seen as the kind of inflexibility and cautiousness when it comes to donor reporting, which can make implementing community-based programs very, very challenging with all that reporting requirement. Middle-income countries and donor transitioning, but the lack of domestic resources. So the challenge we face, particularly in the region, is as countries transition from being low and lower income countries up to being upper middle income countries, which we've seen across the region, they become less, under the current aid model, less eligible for ODA, for external support. Civil society barriers include competition for resources rather than collaboration, lack of institutional systems, or health or human resources among CBOs. So all of the organizations in our study for ERASA were supported by, which was supported by the Robert Carr, accessed most of their funding from external donors, from foreign donors. And participants felt that even if domestic governments in their region were to support their national health response, work on social neighbours, human rights and key populations was least likely to be funded. So even if we move towards a social contracting model, what we still face is the challenge of when communities have to advocate against government for enabling legal environments and decriminalisation, that's been mentioned in the chat, it's very unlikely that a government will fund that kind of work, and a national response will fund that work. And then in our research, participants were mindful of the fact that external funding for their work was probably not good, won't continue indefinitely, and they needed to plan for sustainability of their organizations. But argued that the enablers and human rights work basically is becoming less popular, especially to fund at a national level. So there's a snapshot of some of the global trends that are affecting funding, particularly that affect the region, given that we saw the huge still reliance on external donors for community-led and key population programming and some of the challenges that we face. But on a word of optimism, as has been mentioned in the chat, the most effective responses have been when there's been constructive and provocative partnerships between different sectors in government to promote the innovative responses, community-led responses at national, subnational, community level. That's it from me.
Thank you so much, Anton, for providing that intensive insight into the colliding crisis. Yeah, and yes, more than 50% of the Asian countries are also the low and middle income countries. And yes, there is, a transition is needed from donor funding to local domestic funding. That's very important for ensuring sustainability of community-led responses. Thank you so much, dear panelists, for your responses. They were great. We have actually, jumped over the time, and Jennifer is actually
no, I'm not being very kind, Francis.
Thank you. Yeah.
And I actually do have a suggestion, so don't get off yet, Francis and all the panelists. I know that we did promise people health break, and we are way over time, but I think it's really important for us to have conversation and to provide space for people to ask questions and to reflect. This was such a powerful panel with such a rich and diverse set of experience. I mean, especially every time I listen to Anton, I don't know if I'm feeling I have to feel depressed or what I'm supposed to do. But I mean, it's such a real grounded reality, issues, key issues and challenges that we are facing. So sincere Thanks to all of you, the panelists, for really helping us trying to ground our discussion in the lived experience of the key populations and communities most impacted, right, by all these challenges, including the inadequate and the lack of sustainable financing mechanism for community-led responses. So my suggestion is that let's do some reshuffling or adjustment in the time. I know that there are a number of chat questions in the chat, and I do want to make sure, you know, the participants will have a chance to ask, and the panelists will have a chance to respond to. So I would like to suggest that let's take some questions. Francis, maybe let's not go past till 4:10. We have about 13 minutes to take questions. For those who need to have extra coffee to get up stretch, please do so on your end. But from our end, if everybody is agreeable, let's have few questions from the audience, and then we'll go directly into our last session of the day, which will be moderated from Ina, and we'll be talking about, you know, what are some of these actual mechanisms that we can consider to get us to a more sustainable financing space. And the presentation will be from Iris as well. So I'm going to turn it over back to you, Francis. You have now 12 minutes. Go. Thanks.
Thank you. Thanks, Jennifer. Yeah, there are some important questions here in the chat box, and this looks like an open question to everyone, and feel free to answer. It is evidence is very important. How can we, the community-led organizations, spearhead our own information gathering initiatives to produce our own evidence that services led by communities are indeed sustainable? Anyone? Evidence is very important. How can we, the community-led organizations, spearhead our own information gathering initiatives to produce our own evidence that services led by communities are indeed sustainable? How can we develop sustainable mechanisms?
Francis, I can get us going.
Yes, please, Anton. Thank you so much.
So I think one of the things that's really useful is simple models that show the cost of an intervention and the impact of an intervention is always really important. Because what that demonstrates ultimately is the cost effectiveness of community-based organizations or community-based interventions. And when any government or any budget is looking for how they program, they're looking for value for money. So if you can, you know, we know community-based and community-led service represent value for money, but we're not good at proving it. And so having programs that collect data that can then demonstrate here's a cost for an intervention, here's the value of it, here's the cost effectiveness of it. When it comes to the political argument for making a case for community-led organizations, it becomes hard to refute a evidence-based, cost-effective intervention. So that's the first shout out from me.
Thank you so much, Anton. Yes, Daniel, please unmute yourself.
Yeah, I read a few questions on the chat also. I cannot answer everything with detail here, but Bob, social contracting, I'm thinking it's still a long way to go. It's not only about the regulation; it's about the procedure, mechanism, how to make it work, and we have to be realistic. The NGOs, the CSO is not only HIV. So many diseases, so many NGO, not only for health, for it's also need the direct funding from government, and government will not give the support for 100 or 1,000 organizations. It will be selected, and it will relate the question from Adi. In spirit, focus to strengthen the partners relate with financial sustainability. You know, if my friend come to me, they want to go to fishing, I will not give the fish, I will give the hook. So it's about, so when we have been supporting the organization, we strengthen them, the accountability, the good governance, the professionalism of works in managerial aspect, in leadership. That's about the evidence base, all your works with the result, and there is the information system that we are strengthening all our partners to make them ready fundamentally to become the short-selected potential partners of the donors. So that's the position we've prioritized and focused to bring our partners in that position. So we will not give the fees to them, and we don't have a fees also. Even Spiritia, in many, many years, when many people asking me, how much asset do you have? I said, I don't have 70,000 USD in my account, for Spiritia has been working for 27 years. That I talked to many, many years to my many partner of, when asking me, we don't have 70,000 in my account, in Spiritia account for 27 years. Because this is not a sustainability, how asset do you have, but how to make Spiritia in the better position. Managing one grant of donors, then become 3-5 donors for one program, for local, become national, in better position in the decision making, in engagement. That's about how you engage in appropriate level in the better position to make you more engagement to change the epidemic in your place. That's about.
Daniel?
Yes, I am.
This is Bob Magnani. Can I make one comment about social contracting in Indonesia? Because I think there's some important policy lessons to be learned here.
Sure,
So Indonesia, the Ministry of Finance passed a mechanism which allows the government to forward government financing to NGOs in support of government programs. So the mechanism is there. The issue is, I remember sitting in a meeting with the Ministry of Finance of the World Bank discussing this. The Ministry of Finance doubted that there would ever be enough demand from the implementing agencies to actually spend much money on this. So the social contract is part of a legal mechanism that's also part generating demand by the implementing agencies to move forward and put up some of their money to actually do it. So there's a demand generation side within the government. Once you overcome the financial barriers, there's an issue of demand generation in government units to actually reach out and use the mechanism to engage CSOs. Over.
Yes, thanks, Bob. I think to give more info, but I'm thinking that we have to be realistic with this. There is a policy, there is a mechanism. It doesn't mean easy for you to get the access or the funding, and so many complicated yes, still long way to go.
The funding mechanism, formal funding mechanism to transfer government money to this NGOs is only part of the issue.
And Spiritia will not be in the list also.
Thank you, Robert. There's a comment here. Service delivery and advocacy work done by various organizations are two different things. Sometimes it conflicts themselves, especially quality of services.
Can I join for this?
Please.
Yes. I'm sorry, I have a different perspective. When we are talking service delivery, you reach the transgender, and some transgender get the discrimination. What you should do? You call the advocacy organization to solve the problem? You call somebody, other organization to solve the problem? No. You are the organization, whoever you are, the service delivery. When you are facing the problem, you face that problem. That has been doing in many, many years in hundreds of organizations. So don't divide it with very limitation on that. For service delivery, they are facing so many things when they are working with the communities. Discrimination, stigma, so many complicated to make the clients get the access. on treatment, on testing, on their right, and those organizations working to fulfill. That's about advocacy work. So we don't have to divide it and move to other organizations to solve the problem. We are facing this and we solve this. Thank you.
Thanks, Daniel. There's an important question here from Vahyu Krishna. Finance is like two blades for the organization. It can help in sustainability, but on the other hand, it can make the organization a mess. What can organizations do in managing finances so that it can help in sustainability? A very practical and real question. Coming from, I think, Charisma. Anyone?
Francis Okesi's hand up.
Can I say, right? Yeah, I'm not actually try to answer that question because you know that we already clearly mentioned that every any organization that having access to financing, they should come up with the requirement of the funder or the donor, right? Some kind of requirement for health financial system, good system, auditing system. This is, I think that I could already mentioned that kind of challenges for the capacity for the community to access to the funding, because it may be more requirement, more strict to meet with the community that receive that funding. So another thing I should re-emphasize that, for example, we can say about on sustainability, how to sustain HIV response. For example, in Cambodia, we just develop a HIV strategic plan, and then we can identify which area that really need a community to do that government cannot do. For example, prevention, care and treatment, KP, that we recognize the value for community. So the most important for community to show is to, like Anton already mentioned, to show the cost effectiveness impact of intervention of the work that community really contribute to the program. And at the same time, communities should, along with the building capacity, to meet with minimum requirement to access to the funding. Because I don't think that any funding just give the fund without monitoring, without auditing. So thank you.
Thank you so much, Dr. Oak. We just have 1 minute left and we can just, take two questions, 25 seconds each, because 5 seconds for me for asking the question. This has come from Myanmar Youth Stars Network, and I think it's for Ika. The question says that I would like to know some examples of how youth organizations are standing without relying on donors.
Thank you for the question. I think I want to state here that we as a youth-led organization currently we depend on the international donor, even though youth-led, we are supporting our youth-led country partner organization through the small grant, and it's come from the international donor. I think here what we can do is really to get the commitment from the government that we need to get the commitment from the government to allow the willingness that support key population, including young people. Thank you, Francis. And also to work together with the other key population organization as part of the other activities or the other program on the HIV in the country level. Yeah, I think that's Francis. I don't know what to say.
Thank you so much. Thank you so much. You contact the Youth Stars organization, and Ika will get back to you guys. And these questions are noted because the recording is going on. We'll try our best to respond to each and every query. Thank you so much. And over to Jen. Jen, thank you so much. The host can unpin all of us, please.
Yeah, it was an again to all the panelists, Dr. Chan and Danielle, for that really, really powerful session. And I think grounding us in I need people to mute their end of the mic because people might be eating with their plates clicking. Thank you. So let me, so in the interest of time, let me turn the floor. We have one more session to go before we close today's dialogue. And again, as Francis mentioned, that, you know, please, like, all the questions and comments in the chat will be recorded, and we'll make sure it's captured in the meeting report afterward as well. Again, my sincere plea to the panelists and the speakers to please have a look at the chat, and if possible, please respond to questions directed at you, if you have time, if you're able to as well. So our last session of the day, we'll be looking at the various concept and mechanism of financial sustainability of community-led responses. And to help us with this session, we have asked Ina Rendon, the HIV Programming and Advocacy Officer of APCOM, to help us facilitate this discussion. And Ina, I know you're such a dynamic facilitator, so and you're also you're also really good in keeping us on time. So I'm really going to be counting on you to make sure we finish. That's a lot of pressure, right? On time for everyone's sake. So just a brief info about Ina. He's the APCOM's HIV Programming and Advocacy Officer. He strengthens APCOM's regional and global HIV advocacy and leads in its engagement with key populations and communities. In recent years, he led key initiatives such as the development of APCOM's Community Guide to Implementing Community-Based Monitoring, the creation of Corona APCOM Passion, an emergency fund mechanism to address key populations' immediate needs caused by the COVID-19 pandemic, and the Community Guide to generate demand for PrEP. Much welcome to Ina to help us take over the next session before we close the day. Ina, over to you.
Thank you so much, Jen. You can hear me properly, right? Yeah, you can hear me properly.
Perfect. Yep. Thanks.
Yes.
Cool. Thank you so much. We are now in this session at the end of the day. I think I trust that you have already had your coffee, your break, and we are moving towards the important session. The previous session, we have our panelists discuss their understanding and the different contexts based from the community experiences on what do you mean by financial sustainability of community-led responses. Now, for this session, we will understand, or try to understand at least, what do we mean by financial sustainability of community-led responses. So there are questions that we wanted to answer, such as, what is the concept of financial sustainability? What are the elements that we need to consider if we are talking about financial sustainability? And are there existing financing mechanisms that can serve as good example that we can adapt in our context here in Asia Pacific? Now, before we go to the presentations, we can have like a little bit of brainstorming. We are going to use this chat box. Yeah, our participants, speakers, analysts, the host. I want you to at least chat in the chat box. What do we understand by sustainable financing of the community-led response? If we can have, so I'll share my screen. So who wants to be sustainable? Of course, all of us wants to be sustainable. But for this session, I have one question for the interest of time. Each participant, speaker, facilitator will type in their answers in the chat box. Each will have 30 seconds to type their answers. Yeah. So everyone will have to participate in this one. Well, not everyone, but those who wish to participate, I encourage you to do so. So for our first question, What are the features or the characteristics of a sustainable financing of the community-led response? Now, as instructed, I am encouraging everyone to type in what they think are the features or characteristics of sustainable financing of the community-led response in the chat box. And our 30 seconds starts now. Thank you so much. We have a lot of very good answers here, but I will not mention, or I will not read everything, but I can see here that the characteristics are community themselves proactively make plans and evaluations. There should be collaboration between government and KPO. There's adequate resources for community responses for longer term, and also there's ability to sustain an organization. There's a lot of answers coming in. Sustainable financing should be able to fund the core organization expenses independently from donors. So there's a lot of ideas coming in. Thank you so much for participating. As much as I would like to do the second question, let's not do that. Let's proceed with the presentation. Okay, so for this presentation, as I mentioned earlier, we are going to understand the concepts and mechanisms of financial sustainability of community-led responses. Now, to give us with that concept, or to present us with that concept, I'd like to call on Iris, who is currently the manager for country and regional impact in the newly created UNAIDS Equitable Financing Practice. In her role, she coordinates and guides the technical support agenda and engagement with the UNAIDS regional teams and countries on strategic investments and sustainable financing. She has worked in Eastern and Southern Africa and Middle East and North Africa, supported more than 30 countries, and published approximately 30 scientific papers. She also previously worked as a senior HIV specialist at the World Bank and has served as member of the Global Fund Audit and Finance Committee. Iris, over to you.
Great, thank you so much, and thanks for making us part of this meeting. Glad to see many colleagues that I hadn't had the opportunity to see for a while, and some of us we met yesterday as well, had a similar discussion on financing harm reduction, which is very much in line with our discussions today. Not easy to give the last presentation of the day, but we will try. I hope our great moderator did spark some interest on what is going to make a response sustainable, so we can share and think the discussion, the solution and ideas together. So I will just gonna ask whether I should share the slides or the moderators, the technical expert, will share the slides.
I think you can share the slides, Iris.
I think I can share the slides, right? Okay.
Yes.
Okay, so let me start with the presentation. The reason we asked by asking you to give us our ideas, how do we define sustainable financing for community-led response? It's because this is not a new concept. It exists in many countries. It has been there since the beginning of the HIV response, where the civil society response was at the center of the bringing down the new infection, access to treatment, and access for key population. But how do we frame sustainable financing? It's also dependent on the epidemic, the political will So through this presentation is not to provide a rigid framework. The purpose is not to provide a rigid framework, but it's rather to expose and share with you some suggestions and lessons learned. And we hope that after having gone through the presentation, the next step will be to critically look at it and say, what is missing in this definition or in this approach to sustainable financing? Where do our countries and our CSOs sit in this process, and how we can contribute on moving to the next step? So just a quick reminder, I think Taufik spoke about it and others. There is the new strategy increased focus not only on accelerating the response towards the targets, but brought three new elements. One is about addressing inequalities, acknowledging that HIV response and inequalities intersect, and we cannot end one without ending the other. And the role of CSO financing and all of CSOs have been critical, not only on delivering services, but bringing that social change through their leadership, through advocacy, and through engagement. So that element of qualities adds to our argument of the importance and the critical need for CSO-led response in the countries. We have the new targets. This is the 30%, 80%, 60%. But the other key element that the new strategy brought is that it expanded the vision on sustainable financing for the AIDS response. And it expanded the vision by indicating that it's not about only closing the funding gap, it's also about making sure that there is continuous financing through national systems that enable an effective and equitable implementation of the response. And within that framework of equitable financing of HIV response, it highlights how the community-led response is critical for making this happen. So the idea of sustainable financing of community-led response is well embedded in the strategy, and it's part of the commitment that the governments have made in the political declaration. Just to bring back this idea that there is a funding gap and there is not much time, right? We know that the targets that we have set and endorsed are to be reached by 2025, and failure to reach those targets will not only have an impact on human lives and social impact, but also an impact on financing. Because if we don't reach the target, the cost will grow. If we reach the target, then we have a leveling off of the resources after 2025. And this is an important element to think about and to keep it in mind, because the message is if we invest now in CSO-led response and in the effective programs, then the funding that comes after that will be required to maintain the response. Otherwise, we're gonna take on resources from budgets that are already constrained. Now, let me go through some, what does financial sustainability of CSO-led response entail, right? This is, as I said, this is not a rigid framework, but it's a reminder of the key components. First of all, there is a difference between funding and financing. Funding means that we receive the funding, but it doesn't mean that it's through a mechanism that is sustainable or that is embedded in a continuous manner. So there is a need first to increase the funding for CSO-led response. Taufik showed it, and also the latest report of UNAIDS clearly demonstrates that for services or the programs that for HIV prevention and social enablers, which are where CSOs play a critical role, we need a 25% increase. So closing the funding gap is the immediate need. The second element is because HIV is a lifelong disease, we need that financing for the HIV response, and in this case for CSO-led response, be part of the national systems that will maintain that financing of the response without as maintained for any other health system, right? So this is the financing, the sustainable financing mechanism that integrates the HIV response, and in this case, the CSO-led response in a national systems, and maintain that implementation throughout the need of the programs. The last point, I think it was raised in the discussions in the previous session, is very important, because we shouldn't, the part of the data that we have to understand where is the money coming from, where is the money being spent, is critical for sustainable financing the response. If we want to make the case to increase funding and to integrate the CSO financing into UHC packages, into strategic purchasing, into budgets, or to convince the Ministry of Finance, as someone was saying, then we need to show how the money has been used. It's a very basic principle. So the data systems that allow us to know the costs, but also to track the resources, are part of the sustainable financing mechanism. Now, when we talk about sustainable CSO-led response, we wanted to bring to you 2-3 elements. Somehow, in many cases, it's reduced to service delivery. And we know that financing CSO-led response is beyond that. It includes the advocacy function, where CSOs are so critical in terms of bringing the voice of those who are left behind at the table. Is about service delivery, as we have seen. It's about strategic information, knowing not only the money, where is it spent, but also the epidemic dynamic, the program coverage, and also the community-led monitoring, which is becoming even more prominent. So when we discuss in the framework CSO-led response financing, we are mindful that the funding and the financing should be comprehensive to allow all these services, all these elements to be implemented. Now, the political and legal environment underpins sustainable financing, not only for CSO response, but also for the AIDS response. Because if you don't have the political will, or there is a political resistance to invest on CSOs, then that is impossible to have a sustainable financing. We need to find
Iris? Sorry to interrupt. So we will have to ask UNAIDS to share your slides from their end, so that they can operate the slides from their end. Thank you so much. So we are here now. And then you can just let us know if we have to move to the next slide.
Yes, okay. So then I can continue while they do it, right?
It's already shared in the screen. They have already shared your slides now.
Okay,
so you can continue. Thank you.
Thank you. So if we want to unpack what the sustainable financing of CSO-led response means, is that there are a few critical elements. First, we are talking about CSO-led response. It's not only about CSOs themselves, but it's about how do we leverage the social capital that CSOs bring to implement the response and achieve our targets. The second element is to make sure that the financing is not, as we have seen in some countries where domestic financing has absorbed the HIV response, they do not necessarily fund all the program interventions. Like, for example, in some countries, they will absorb harm reduction, but they will not fund OST. So reducing, not being able to finance the entire effective program package reduces the effectiveness of the HIV response. So this is to say that sustainable financing of CSO-led response is about funding up, it's about having secure financing of the response, but we go to a granular level where we look at whether that sustainable financing is funding the comprehensive program package to maintain effectiveness. We look at whether it's financing all measures that remove structural barriers, policies, legal barriers, but also financial barriers, like out-of-pocket expenditures or that people have to access services. Otherwise, these barriers will make the response inequitable. So the financing has to include the allocations for this type of elements and ensure full implementation of the response. And then in terms of domestic financing, we have the integration into the national financing arrangement and delivered as part of a national system. And I'll come back to that. Next slide, please. Now, this is a very simplified way to portray the different financing models, right, or financing sources. But we wanted to make it clear that there are certain distinctions because also the way we approach it, it's defined by the model. First of all, they are not mutually exclusive. One CSO or one organization can use all of them, right? And it's not comprehensive. There are different sub-elements that we can identify. But in terms of where is the money coming from and what conditionalities is coming from, then we have classified them in terms of social contract model, which is the government funding, the public domestic funding, right? That's the public funding, is used to finance CSO-led response. And this can be done through the budget, through the health insurance, from UHC benefit packages. Now, in terms of health insurance, there is also some private contribution in many countries, but because it's a mixed, pooled, arranged resources through the government and country mechanisms, we have included it under social contract model. Then there are the grants, like donor funding can be Global Fund, PEPFAR, many other donor philanthropic entities and other sources, national or international, which are usually based on agreements. Then there is another world of financing instruments, which can be social impact bonds, which are in place in some countries, microcredits, blended financing, debt swaps in some countries. So and this area of financing instruments is growing, particularly in the context of financial instabilities. So how CSOs can access the financing instruments, it's usually less clear that the understanding that we have of social contract models. And then the last element, it's income generation, where many CSOs engage in income generation through pharmacies, through services, through many different services that you know. Next one. Now, UNH has done a review of progress made in social contracting in 59 countries. And there are a couple of elements that we wanted to share, mostly as illustrative highlights of the challenges and the issues that are emerging. First of all, social contracting is much more than a contractual agreement, because by engaging with CSOs, I think Anton was explaining social impact and social change, right? Next one. Now, the results of the study show that despite there is agreement at the global level, at the country level, that we need, through the global fund policy and strategies, the PEPFAR strategies, government had endorsed it, that social contracting is important. And in the next slide, you're going to see the findings of this study analysis, where we saw that despite this overall agreement on the social contracting and public financing, only 30% of countries have operational social contracting systems in place. And usually countries spend more than 1 year from the start of the analysis or from the start of the situation assessment to operationalizing it. And I'll come back to see what are the key elements that make the countries move ahead. The point to make it here is that there is a need to exchange, to generate data, to provide technical support, that countries move to the next step, one. And the second is also that every country should start establishing social contracting as a public financing of CSO-led response, because it takes a lot of time. So in the case that the donor is exiting or the country is left without donor funding, it's not possible to establish it immediately and make it operational. So regardless of the country's ability to pay for the AIDS response, every country should start such a process. And one of the significant barriers are legal and regulatory barriers. The reason we are mentioning this is because it's not unheard in countries to have CSOs participate in the healthcare delivery. A community system is part of WHO definition, but with the HIV response, the complexity and the challenges are related to the legal status of the key population. So having CSO, key population-led CSOs, where they are marginalized or illegal, it adds a different layer of complexity. Next slide. Now, the models of social contracting that we have identified, there are different models. One is where we have countries where the government has a process of accrediting the CSOs, and then it provides the funding directly to the CSOs that they select without any competitive processes. Or there are the umbrellas NGOs, like in the case of Malaysia. There are countries where we have a competitive bidding, like the government does for subcontracting services. And the challenge with this is because reaching those very hard to reach will cost more than the normal other populations. So the cost element as a competitive factor might undermine the effectiveness of the response. The funding can be from the national level to state or from province, in particular with the decentralization. And this comes with the challenge that of the health financing challenges and inequalities at a decentralized level, because often you don't have the same package of services, or when they move from one region to the other, might lose benefits. And another mechanism is through health insurance, which I think there is in Philippines and in Thailand, in Asia Pacific region. Next one. What does the public financing covers? It covers usually a limited, quite a narrow set of activities, right? It covers key population prevention, testing, outreach, education campaign, but then there is less investments on linkages with care, on ARV, on self-testing, new health technologies, comorbidities. And there is very limited scale. I mean, there is a gap between the science, implementation science, and then building those new elements into the CSO-led response. Next slide. Now, we focused on social contracting because it's imperative that CSO-led response is part of the national systems, right? Otherwise, we won't be able to implement and sustain the AIDS response or maintain impact. Because even after you reach epidemic control or the epidemic transition point, there is always need to continue preventing new HIV infection and ensuring viral load suppression. And CSO role is critical. So having a CSO-led response and integrated in the national system is part of the sustainability of the AIDS response. But there are some limitations, which we heard those from the community organization. First is that budget restrict the level of funding and the type of use of funding, right? Where there is a political economy or the government is hostile, then there is no progress in integrating CSO-led response in national budget. Very few countries, I think Anton said, another colleague said it, that usually when there is a contractual agreement, they see what the money is buying. And sometimes this restricts the investments in capacity development or social change, right? Which is not usually as tangible as it can be with service delivery. Community organizations in many cases do not want to receive government funding to conduct certain level of advocacy in order to maintain their independence. So there are also some of the elements by choice. And then we have seen cases in countries then with the financial crisis and the budget reduction or cash reduction, the first contracts to be interrupted or ended are those with external partners, including like public-private partnership, like CSO-led response. So it's not sustainable to rely only on that source of funding. Next one.
Iris, hi. I would ask to wrap up in the next minute. Thank you.
Sure. Next 2 minutes. Sure. Next one, please. So if we look at the models and we look at the income generation and other models, next one, because this is a repetition. we have seen, and UNAIDS have provided some funding, USAID and PEPFAR have provided funding, is that you can engage with the CSOs, and this funding also helps not only to implement activities, but also to reinforce their capacities. Like the question that was asked about young people CSOs, for example, we had many examples in Africa where this funding enabled them to strengthen their organizational capacity and be more independent. Next one. One major challenge for ensuring CSO-led response financing is that there is very limited investment on strengthening organizational capacities, financial management, transparency, data analysis. And this impedes the capacity of CSOs to access all type of funding. Every donor, every funder, be government or international, will require reporting. So, and the current funding streams for this purpose are very limited. So this is a gap that we have identified. Next one. This is about, so let me move to the framework that we have identified to implement the CSO-led response financing. First is the strategy that we mentioned. The second is they are critical as game changers in reducing inequality and also building people-centered system and strengthening primary health care. So when we advocate for increased or establishing CSO-led response financing, it's not only about HIV, it's also because we are strengthening the platform of people-centered systems, which became so strong after the COVID crisis. So we need to use the arguments of looking at the holistic impact of CSOs. Next one. So to wrap up in terms of sustainable financing is there are key components that we look at that need to be pursued simultaneously. One is about closing the funding gap, be it through global fund applications as now, or PEPFAR funding and raise other resources. The second is to look at the assess and advocate and bring changes to the legal and regulatory environment, not only about public financing, but also accessing market resources. Like many CSOs have said, they would like to access the pandemic preparedness mechanism that was established by the bank. They need to be established as such in order to access those resources. The third point is about integrating CSOs as implementers in the national healthcare system, in the strategic purchasing mechanism as part of UHC. This is the way that you can channel then public financing to CSO-led response in a sustainable manner. And more importantly, we need the international assistance. First, because there is a funding gap that cannot be filled immediately, and we need to accelerate the target. So it's the timing issue. So we need international assistance while we work on domestic financing, but also to address political economy. Next one. The next component of the CSO-led response financing framework is about partnerships. It's about South-to-South partnerships. It's about collaborating with the regional networks. So the voices are reinforced and amplified. It's also about better coordination among international partners. We have seen often that donor predictability is not always transparent, and where transition has happened in ACE, then there has been a service disruption. So how can we improve those elements and be ahead of time is important. Next one. And the last one is about generating evidence, which we're saying. It's about generating evidence and also integrating CSO-led response in the data systems. The impact is beyond HIV, and it's a long-term impact that strengthens public health. So the CSO-led response needs to be integrated in the data system. Immediate priorities would be to improve our understanding of how to strengthen capacities for advocacy, for budget increase, to examine financing models, payment modalities, to assess financial barriers so we don't have the barriers that are inherent to the health system, creating more challenges for the HIV response. To think about the metrics. Until now, we have measured CSO-led response financing by saying, is it social contracting in place. But that has so many layers. So maybe we can be more proactive on defining metrics and then expand funding. We need to finance strategic information. Next one, and that's the last one. So if we look at the pathway, many countries say, how do we start and what do we do? So we identified the key steps that can happen, and some of them in parallel, but there is a need for CSOs to map where they are more of added value and complementary, dialogue with the government in order then to copy the roadmap for establishing civil CSO-led response financing. And this includes assessing the costs, understanding the contractual process, etc. And I'll stop here. Thank you.
Thank you so much, Iris. We have 3 minutes more, but Jen, I will ask for your permission that I will ask 2 more questions to Iris, if that's okay. If not, then we can proceed with asking the questions on Thursday.
Let's take 2 questions and let's try to, yeah.
Okay, I have listed the questions because I was just also keeping the time, but during the presentation, it was mentioned that there are several elements in ensuring that there is financing and that funding and financing are not the same. One of the important elements that was mentioned is the political and legal environment, making sure that we remove policy and structural and legal barriers to financing. In the context of Asia, and I think this was raised to me directly. In the context of Asia, the key populations are still criminalized, particularly the drug users, the injecting drug users, the sex workers, and in some parts of the country, the MSM and some parts of Asia, the transgender women and MSM. So the questions were, how can we effectively support the registration of the networks who are unregistered because they are led by the key populations who are criminalized? And second, how can we effectively advocate to the funders, particularly the Global Fund, since NFM4 is coming up, and also the COPROC, that there is sufficient support in addressing the structural barriers to ensure that the KP-led networks are able to perform their functions?
Should I answer those 2 questions? Okay, I'll start with the second one because that's very, so in terms of Global Fund and PEPFAR COPS, there are a couple of elements that we can use to make the case in the Global Fund resources, to raise the Global Fund resources for KP networks. First is that there is a clear commitment in the Global Fund strategy and the UNAIDS global strategy and the Listen to UNAIDS report that without removing structural barriers, and I'm generalizing including legal and other elements, the response will remain ineffective and HIV infections will grow. So there is an agreement with Global Fund on this. There is the evidence to show that. We have examples where countries where sex workers and injecting drug users are criminalized have a much lower viral load suppression compared to other countries. And we can also make the economic case. Every new infection costs, from a societal perspective, at least one study, this is not to be generalized, but more than $500,000 in terms of management of life costs, because it's over 30 years. And so the choice is whether we want to have new HIV infections, which are going to cost even more in the future, or invest now. And this is where the CSO-led response is critical. The other key element that we need to include in making the case in the Global Fund and the COP is also to make the case for increasing capacities of the networks to operate independently. And this includes the legal, addressing the legal barriers. In that way, CSO can pursue different financing options and not be dependent only in one funding source. Now, how can CSOs overcome the legal barriers? I think I will also ask other colleagues who are much more experienced than me in working on legal barriers. But my experience where I've been in the Middle East and in some other very difficult contexts working with key populations has been that first is do no harm. So there are mechanisms in order to ensure that key population have access to services and they are protected. While in parallel, we have seen that working in decriminalization and changing laws and regulation has happened in some countries. So there are mechanisms to make it happen. It's not overnight, but it requires a lot of efforts and evidence from different partnerships and synergies. I'll stop here.
Thank you so much, Iris. And I think what you have mentioned is really vital, that it's not only one person who can answer these questions, but it's a product of continuous discussions amongst our partners. Now, thank you so much, Iris, for that presentation. And thank you for the participants for having your attention for this session. I'm going to hand over now to Jennifer for the closing. Thanks, Jen.
Thanks, Ina, and thanks, Iris. And Ina, thank you so much for making sure that we close on time for that session. And I'm going to borrow your opening slides and music for my next presentation. That was rocking. So, and also thanks to Iris for such a comprehensive presentation of the key concept and mechanism that we should all be aware and be thinking about as we move forward with our discussion, but also, our collaborative joint effort towards sustainable financing for community-led responses. So, as mentioned, we're now coming to the end of the first part of our regional dialogue, and I know that today has been a really, really packed session of information and of experience sharing. And I do see that there are a lot of really thoughtful comments and questions in the chat, and I think for the three co-conveners, we're trying to make sure that we relook and if necessary, do the necessary readjustment for our next dialogue to make sure that we can get more direct conversations in between the presenters and the participants. But as mentioned earlier, that all the questions and comments will be captured in the report. And again, I encourage everybody to have a look at the questions and the comments because they are really, really valuable. And I think they're quite thought-provoking as well. So to help us, one last thing, and yes, the presentations and the materials from today's session will be shared with all registered participants. So if you haven't registered yourself, please do so before the next dialogue on Thursday. So to help us close today's session, I'd like to re-invite the three co-conveners to come back on again, and each of you will have 90 seconds, not 2 minutes, to give a closing remark. And so I want to first invite RD, if that's okay, to just give 90 seconds of closing remark, followed by Heather, and then we'll wrap up with Veronique on behalf of UNAIDS RST, who has spearheaded this whole planning process especially. So RD, over to you first. RD just said in the chat that that they can't turn on their mic right now, but put my remarks in the chat. Okay, thank you for saving our time. So if that's okay, maybe I'll just have a quick read so the interpretation can also happen for our translation. So on behalf of RD, hi everyone, I'm in transit and it's too noisy inside the car for me to turn my mic on. We'll just message here and say thanks to for all the knowledge and experience sharing. I think we're past the why of financial sustainability of CLR. The rationale is well established. There are also models of doing this to build on. We need to move to the why still not happening and how to move forward on community-led response, country by country, community by community. What is clear is we cannot achieve financial sustainability of community-led responses without achieving first and two, sufficient and sustainable financing of the HIV response in general. APCASA looks forward to continuing this conversation, seeing all of you again on the 8th for part 2 of our dialogue. Thanks to Veronique for all the wonderful work behind the preparation for today. Thanks to Jen, that's me, for the overall facilitation of the session and the session moderators and the excellent resource persons. Thanks, colleagues and friends. So that's from RD. Let me next invite Heather on behalf of USA and PEPFAR for closing remark. Heather?
Thank you so much, Jennifer. I felt really energized by Enad's exercise at the beginning of that session. Thanks for that. It was a nice change of pace. My first inclination is to feel a little overwhelmed with the complexity of the task at hand, but I'm just so encouraged by the interest that this session has seen and the broad base of countries and variety of stakeholders represented. And each of us comes from a different place in our profession, the current position that we're working in, and our lived experiences. But I see very clearly that we have common objectives here, so to work towards, so that's really encouraging. And I heard some critical areas that need attention: decriminalization, political and legal environment and barriers, looking at capacity building for youth KP organizations and other organizations, including financial management, and then the piece on independent agenda setting. And so I just want to say I look forward to continuing this conversation on Thursday and beyond. And it has been really fruitful so far for me, and I hope that you all feel the same. So let me turn it over to, I'm not sure who I'm turning it over to. Back to you, Jennifer.
And with that, thanks, Heather. And let me turn it over to Veronique then. Thanks, over to you.
Thank you very much, Jennifer. And so from my side, I would like to thank wholeheartedly the speakers, the panelists, the facilitators for making this first part of the regional dialogue a success. On average, we had more than 220 participants throughout today's session, which really signals a very strong interest in the region for financial sustainability of community-led responses. I would also like to thank the interpreters for their support. We tried to be as inclusive as possible for this dialogue, and we trust that the availability of interpretation in 5 languages has helped for that purpose. I would like to thank in particular USAID and ACASO for co-convening this together with us. And just a reminder that so we will hold the second part of the dialogue on Thursday afternoon. If you have not yet registered, please do so. We will hear about social contracting with the field health example. We will hear about social contracting status and challenges in Cambodia, in Indonesia, in Thailand, and a few other countries. And then finally, we will hear from the Global Fund, PEPFAR, UNAIDS and France about how they can support community-led responses and financial sustainability in particular. So welcome to the second part of the regional dialogue. And if I can just suggest, Jen, if all participants could turn on their video, we could take a picture of today's session. Thank you.
Sure. And I'm very technically challenged. I don't know how to do all that screen grab. So I would just